So we are on week 3. Week 3 is finishing up the growth and development. We're doing school age children and adolescents. There is a quiz this week also. It's actually easier than last week because of all the theorists. That's what makes it a lot more difficult, that last quiz. But it shows you how important it is to understand them, because you will see them on your HESI and you do see them on the NCLEX. And we tried to choose those theorists and those questions that you see the most, okay? So it is important to understand them like that. You also have NCLEX questions due. And this week, we are doing preparations for exam 4. I am going to be doing the first review tomorrow at 1 p.m. I do record them and I do put it in your announcements. Now, let me tell you something about the way I put the announcements in for the recordings. I leave it in one announcement, I edit, add the new recording in it, and then you have one only announcement to look at for all the professors, all the recordings. It'll have all 3 weeks Kahoots in one place for you, and it will have the PowerPoint study guide that you also need for the review and to review for the exam. And everything you need to know is on the PowerPoint. It's not like something you study and nothing's on your exam, because there are some things that you might see on NCLEX, you might see on the HESI, but these reviews are important. And prior to your HESI, hint, you should also go back and look at every exam review, because they do have invaluable information and you will see it again. Any questions with that? We will be doing the exam on Zoom, and we will be doing it during class time. After class, the exam is due. We still will have a class. There's still information week 4. It's actually endocrine, so it's pretty heavy, some of the stuff that's in there. That's week 7 class. And then we have a lot of variations for this week, which is also the exam. So what I've done is I made a Kahoots, of course. And that Kahoots has all those concepts that as you're doing your interactive PowerPoint or looking at the PowerPoint I send you to, because you will have the week 4 PowerPoint, you are going to be able to see, okay, this concept, let me read about it more, and let me see how I can apply that in different ways. And then you'll be really good for exams. Again, if anybody looks at the Kahoots, feel like I'm not giving them enough, what's go over the PowerPoint with me, I don't mind, just let me know. And I'll get with you when you can, with your time schedules, because I know you're all pretty full here. Your reviews are all on your calendars. So you want to know when Professor Okorafor's review is, go to the calendar. The Zoom numbers are in there and everything. You don't have to look, you don't have to think. You have the announcement in one place and they're all on the calendar and all of the dates and times are there. So you are all set up to be organized to be able to study well for this exam. So let's go ahead and let's start with our PowerPoint, and then we are going to go and do our Kahoots to follow it. So this week I am on vacation, so I might be a little slower answering some of your emails, but I'm still here and I'm still going to be available to you. But usually you'll see me answer in seconds. It probably will be in every evening or early, morning that I will be answering them. So, hold up. Christian, I'm teaching. It's okay, just hold my phone, honey. Okay, school age children. This is ages 6 to 12. It starts when they start losing their baby teeth, their deciduous teeth. And in the end of their growth of school age is when all their teeth comes in and puberty begins, okay? They start as really young children, young minds, not thinking as well. By the time they get 12 years old, they're almost an adult. So a lot of changes go on here. Their height, it slows down just like it did after infants. It's 2 inches a year. But in 6 years, you could gain 1 to 2 feet, depending on your child. Weight, 2 to 3 kilos per year. It can double from 6 to 12. And boys and girls at this point are not different at all. It's when they get to adolescence and those growth spurts there that you're going to see the boys get taller than the girls. Children get more graceful. Very awkward. Think about a way a toddler or a preschooler walks and they fall over a lot. Well, they're going to get more graceful. They're going to get more muscle tissue. Their fat goes away. All that baby fat goes. There is no correlation between head circumference and the height or anything. And those faces go from baby faces to mature young children, almost adolescents at that point. And I love it. It's all I want for Christmas is my 2 front teeth. All of their teeth are falling out. And I just think children missing their 2 front teeth is actually pretty cute. The thing with their body systems, again, they're developing more heart rate, blood pressure goes up a little bit higher, heart rate, respiratory rate increases, and gets almost to the point where you are at that, where you're at that adult level. The bladder, they're able to hold their urine a lot better. Their heart is getting smaller in relationship to their body. Earlier, the heart takes up a lot of their chest. Their immune system, they've caught so many viruses and gotten sick that their immune system is getting really strong. They've had all their vaccinations at this point. So the body is really strong to fight infection. Their bones become more ossified, which means they crack easier. Remember I told you the infant's head are soft and malleable and their bones are soft. Well, by the time you get to the end of school age, they can crack a lot easier. Now, the one misconception with children, and be very careful if you ever work with school age children, some 12-year-olds look like 20-year-olds. They could already have their breasts and look mature, but remember, their physical maturity does not correlate with the way they look. Their emotional and their social maturity are not the same. They don't understand things as an adult does. So don't treat them as an adult, still treat them as a 12-year-old. So as I said, the end of school age, we start that prepubescence and puberty time. So what do we see? Well, the ages from 9 to 12, you're going to start seeing girls mature. Remember, boys mature later than girls. That's why when you're in 5th and 6th grades, boys are stupid and dumb, right? Because they're silly and they're not mature. I still remember going, "Ooh, they're stupid. I don't like them boys." And then, of course, you wake up and all of a sudden you want to have a boyfriend. But just the girls, it's a 10-year-old is where puberty usually starts. Boys, it's 12 years old. Girls, you start getting nipple buds. And in boys, you start getting enlarged testicles. I mean, you're not going to see those things, but if a parent, you may be able to. So doing assessments, remember, 6 to 12, big, broad time. So you need to get on their developmental level. I think one of the questions that a lot of you got wrong on the quiz was when you walk into a room of a toddler, the first thing to do is to not go straight forward to them. You need to first break open that relationship by talking, not giving them the equipment yet, but first talking to them and let them know that they're going to have fun with you. Okay, that, all right, now here are the toys. So it's not, yes, they are going to play with the toys. Great answer. But first, give them a little bit of time. We're going to take the assessment and describe them in different ways. For instance, many children go into an emergency room with a cough and they need an X-ray. Now, for a 6-year-old, we need to explain that this big thing coming at them is not this big, a laser radiation at them, going to shoot them, because this is the way these little children think. Just say it's a big camera and it's going to take a picture and we can see inside your body, but it doesn't hurt you. It doesn't touch you, but it's a big machine. So don't be afraid of it. It's not going to fall on you. It's not going to hurt you. And then what I do is I'll let them see their pictures. And it really stops them from being afraid of getting procedures done. Now, a 12-year-old, you just say an X-ray. So they're just going to shoot an X-ray. They might know what it is, or that 12-year-old might need the same explanation. So you got to figure out which one they need. You inspect, you auscultate, you percuss, you palpate. Remember those lymph nodes? We've talked about it before. It's been part of our Kahoots. If they're well, you shouldn't feel them. Only when they're sick do we feel lymph nodes. Now, one of the things we need to do is to examine the hypoglossal nerve. So how do we do that? Even infants will do it, but 6-year-olds for sure stick their tongue out. We know that nerve's functioning when they stick the tongue out. Also, as we're listening to the lungs, we need to know what we're listening to. So there are different sort of areas on the chest that we listen to. So if we want to listen to those bronchial, which is all the bronchus, that's not into the lungs yet, but in the bronchus, which is usually a lot of upper airway secretions. Children always with a runny nose, and they're always coughing, and it's all up in the bronchus. And they cough is actually, they can get rid of a lot of it. But if we take and listen to it over the trachea and the suprasternal notch, which is that little, hole in between, your clavicle there, we listen there, we're going to see, oh, there's noise there. That's the sound of not the lungs, but the bronchus. Don't be misinformed that it could be the lungs, because that's a referred sound. So now you said, yes, it is. And sometimes I'll even listen to the neck, because that will reconfirm it's all upper airway. The lungs are still clear. So we haven't really talked about Freud yet, but Freud is all about things with sex and things that are involved with it. But when we're talking about Freud with the school age children, we're talking about they like same-sex peers. Boys are with boys and girls are with girls until the end of this school age period. So Freud talks about that it's the same-sex peers is the most important here. Erikson, all right, let's go into what Erikson says. Well, Erikson is industry versus inferiority, okay? So industry, what is it? Well, industry is those things they do well. Do they spell well? Can they do math well? Do they write well? Or do they play soccer well? Do they swim well? What do they do well? They're accomplished at, and people make comments that are saying, hey, you do that really well, okay? And of course, they like the peers telling them they do well. So industry is the task they can do well. Inferiority, they can't do everything well, can they? They might be good in the classroom, but they're a klutz out on the field, right? So they're inferior there. And that's what gives them a feeling of inferiority, because they want to do everything well. They're pleasers. This is what they want. So when we talk about this again, industry, a task, doing it well. Inferiority, those things they cannot do well. They cannot master that. Now, Piaget starts talking about, this is the mind, cognitive, ability here. They're able to think about what they're going to do and how they're going to get there. They're starting to understand that if they want to do something, how they're going to get there. It's almost critical thinking at this point. They call it conceptual thinking. They also are masters of conservation. And I use this about my children every single class, and it makes you understand. So let's say your mom goes shopping on a Friday, which I used to do for my kids. And I know they needed a snack when they came home from school because they were hungry, of course. So they loved Little Debbie cakes. And in the box, there are 10 cakes. I got one for my son, one for my daughter. Now, if they ate them all that weekend or all in the first 2 days, they knew there'd be no more left by next Friday where I'm bringing the new ones in. So they learned to conserve the cakes till we get there, right? So that's a very good example of conservation. They also know that liquid, whether it's in a tall glass or a squat glass, pouring it in, it's the same amount of liquid. It's just a different shape of glass. A piece of clay, whether it's round or smashed, it's still the same amount. Pennies, organized, not organized, all of these things are the same thing, but a little bit different. And they're really understanding this now. Kohlberg, again, remember, right and wrong, and there's going to be a consequence for each. Well, they're also able to understand why people do things. They're also knowing that what they do, right or wrong, was that wrong worth it to do it for that punishment? So let's say you weren't supposed to go home and turn on the TV, and you did, and mom walked in, the TV was on. So then you're punished, and then she took away your pad or whatever. So, all right, was it worth it to see that TV program or not? Now they're understanding that. And they're also getting more understanding of other people's needs and desires. They want to please their friends, their peers, their same-sex peers. Their spiritual development continues. These children have now had at least 5 or 6 years of all the holidays and going to church or whatever, the family's involved in. And they're starting to think now, and they do want to know, who's God? Who's Jesus? What is this Bible all about? They know that if they do something bad, they're going to get punished for it. And they also feel that God has punished them. Okay. So they know that if they got sick right before they were supposed to go on vacation, they couldn't go because they had done something wrong and they expected to be punished for it. Again, social, same-sex peers, so important. Sometimes you're going to have children that maybe they wanted to play softball, but their best friend, their best peer, same buddy, isn't, say he's not in softball, he likes soccer or softball, whatever, he'll switch to that kid's interest just to be with them because he wants to please them and he wants to be with his peer. They are understanding that girls do certain things and boys do certain things. Girls like pink, boys like blue, as simple as that, or boy movies, boy toys, girl toys, dolls. They're understanding that there are differences between boys and girls. They're involved now in clubs and groups and Girl Scouts and 4-H and brownies and all of that. And they are good to have because, again, it's social and being with other kids is always very important. And of course, then you have another adult that they're listening to. And, you have the teacher, of course, but now you have another adult. And that is good for these children to be following the rules of someone else in another organized fashion. Their families are so important to them. Again, they are that primary influence that shapes what they know, their personality. It's going to be like their family, their behaviors and their values. It's because what they're shown at home, they emulate. They're going to do that too. They do have more independence, which means they can go walk, 4 houses down to their friend's house without mom now because they're becoming more independent and they have earned that independence. They're getting older, they're understanding. And at this age, parents do not need to be their friend. They still need to be an adult that keeps the rules and keep the good structure for these children. Play. Do school-age children play? Of course. Again, play is part of it. It's that rules, following rules and rituals, so important. Working together as a team, being able to do things by themselves. And then this ego mastery, like this little girl playing a piano, they are doing things for their own person to feel good about themselves. Again, that's part of the industry too. Their self-concept, they're starting to understand what they're good at. They're starting to understand what do they look like. Girls will want bows in their hairs and boys are going to want, cool clothes or cool sneakers to wear. They're aware of this. They're also aware that other children have glasses or braces or curly hair or freckles. They're understanding all of that. All of the adults that this child's life touches, whether in school or in clubs or in sports, all do have a significant impact on them. So you need to be aware as parents who these adults are to make sure that they're giving those positive influences that are needed. So when we let these children feel they're doing well, encouraging them, telling how well they've done with school or this, or you're proud of them for trying, this leads to that being happy with themselves, which is self-respect. And it gives them that self-confidence. And this child's going to be happy. That child's always told how well they're doing or how proud at least they tried is very important. Their body image, like I said, they're starting to see themselves grow. And one of the things that I think girls always look at growing up is their hair, putting their hair up and doing styles and putting bows and barrettes and braids and beads, and really important. And they're also, when they have those different color eyes, those blue, the green, what do we do as we start getting about 10, 12? Going to start trying to play with that makeup, right? And what do girls do first? That cute little whiffs with the black little lines and the colors, and it's trying to look pretty. Eyes are so important. And of course the hair is too. And they really like to look a way that they want to feel good about themselves. And that, again, is self-respect. Again, they're going to see all the differences in other children. Earlier than this, they didn't see things like hearing aids and glasses. I mean, some might, but school age, absolutely. So growth and development. Remember, we've gone from preschooler right into school age. School age is when they go right into kindergarten, and it is a longer period of time. It's a little stricter than what preschool would be. And it is, again, somebody else taking care of your child away from the home. So again, the school, the children in it and the teacher now are giving them their values. They are probably going to celebrate more holidays or different things that you do at home. They're going to be becoming more aware. And again, peer relationships are getting important. They talk about it. They want to be liked. They want to have a friend. Nutrition, 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 all through your life. Number one, most important thing, feed that brain, feed that body. So it's important that it's balanced to promote growth. And we know that food should be good. We know today you need two parents working. Many times it's run through, and get a pizza for dinner, or McDonald's or Burger King or Taco Bell or whatever. It's not the best quality. It's because today of the way our life is. But if we can introduce to these children, about understanding the food groups, and school age children love to learn, okay? So teaching them about food groups and how many of each they should have every day. This My Plate is on the internet, and in school today, they're teaching them to go and they look at it. But remember, nutrition depends on the family. Good nutrition costs a lot more than just eating, what you can. Macaroni and cheese is easy to put together. So one of the concerns about school age children today is obesity. Now, why is that? Well, it's reaching epidemic proportions. We know it. Children now are sitting home. They're watching the computers. They're watching the video games, talking on their phones, and they're not getting up and going out. Well, it could be due to low-income family, neighborhoods, and they can't go out. It's unsafe. But it could be that they're not encouraged to get up and go out. I know President Obama's wife, Michelle, having them out and activity, very important to be able to have those children understand it. Because we know that if we are going to teach these children to not be overweight, we know that the chances of diabetes have lessened a lot. So overweight children are going to grow up to have high blood pressure, could have high blood pressure, diabetes, high cholesterol, and there's all of these what we call cardiometabolic changes because of them being so heavy. So early education and school age is the perfect. It's like, what do you teach school age children? Those programs like Dare to keep kids off drugs. Why do we do it in school age? Because they are so willing to learn. So early education on diabetes has shown to prevent obesity in school age children. Sleep. Sleep is not as important as the younger child. They're probably not going to take a nap anymore at any time in the day. They will sleep at night. We know children who are younger will fight going to bed. One more story. Can I need a drink of water? I need to go kiss daddy again. Oh, I need to go to the bathroom. It's that prolongation of going to bed and turning out that light. But once they get older, into that 10 to 12. They don't care anymore. They're tired. They're just going to go to bed. So that's sleep. 9 to 11 hours should be. Sports, important. Again, this is a social activity where they're with another adult teaching them the rules and structures of a game that is, really organized. Problem with sports is that children need to know how to deal with the emotions. Everybody wants to win. You ever see it, even a preschooler, they want to play a game, they want to win. I want to win. Did I win the game? And that's part of the emotional immaturity that we need as parents and as coaches, if we are, to let them know it's not winning the game, it's how hard you played it. Whether you win or lose, did you have fun? And if that's expressed, that's a great game to play. There are, and I know I live in Miami, a part of a culture where there are parents, and I've seen them, and in all different cultures, you'll see them screaming at kids if they miss a fly ball and they didn't catch it. Well, hey, at least they tried, It's that they catch it would, of course, be best, but you can't have these children need to understand the parents and the yelling, because it can have them cry and be upset and do not want play sports. And we know children love competition. Dental health. Well, we know that children are losing all of their deciduous teeth. They're coming out. They're going to be gone. So they're going to get, all of these teeth, and the tooth fairy comes, and etc. But we need to be brushing our teeth. Now, flossing, of course, is the best, but a first grade child doesn't have the manual dexterity to floss as well as he could. But at least if they brush before they go to bed, very important. This is the age where they're probably going to be having, as their main teeth come in, their permanent teeth, braces. So they're not these crooked teeth as they get older. And another thing that happens is dental injury or a complete avulsion. Now, I've had many children be in the pool, come down on the ledge, and they get a cut underneath their chin, and then their tooth hit the thing, and they have a front tooth out. Now, if it's a baby tooth, we can reinsert it, but it's not as important as that permanent teeth, because putting another permanent tooth in there is very expensive, and it's a process for that child. So how can we get that tooth reimplanted? The whole tooth came out. There it is on the ground. Well, you should pick it up and put it in cold milk. And why is it cold milk? Well, I think milk has something to do with calcium, and the cool keeps the root from, dying. I'm not sure. But cold milk, put it in. Some of them put them in baggies, we'll put them in jars, it doesn't matter. The dentist comes in, numbs that area, and then they can reinsert that tooth, and then they're on a soft diet for several days, and they follow up with their dentist. Sex education, remember, they've been exploring themselves since they were toddlers, which is normal. So it's normal thing, again, have them play with, if they're touching themselves, that's private time, go in your room by yourself. It's nothing to be made them to feel bad about at all. Sex education, you need to find out what they know and what they're asking for. Not every child who asks the question that you think is direct is they're looking for the answer that you think it should be. So talking to them is important so that people don't touch them in wrong places, because unless they're told, they don't know what's right or wrong. So talking, effective communication with parents is important. Now, many parents, like my mother, never wanted to talk to me about this sort of stuff. So she sent me to the school nurse, and that's where I learned all my information from. It is a great person to get good information from, and that this nurse has had many children ask her, so that they are going to get good information. So your school health nurse, besides doing sexual education, whatnot, they've done so much more. What happened when COVID came out And then the school nurse had to decide what to do for her children, working with the CDC and infection and, making it safe for everybody. They also are involved in things like children who have bacterial meningitis that are in classrooms that have been admitted to the ICUs. What about those children that have been exposed? This is what the school nurse does. Sometimes it's education, sometimes it's, doing some health examinations and counseling, or it's having those parents have somebody for their children to talk to. Motor vehicles in every level is your number one unintentional accident, all ages. That's number one. We know rear vehicle, sitting in the rear seat until age 13 is what the book says you should do. I know when I was divorced from my first husband, my children were 9 and 11, and they used to always call shotgun to get in the front seat with me. So I guess I was doing something wrong according to the American Academy of Pediatrics and what they deal with motor vehicle safety. They should be in booster seats till 8 years old. So this is what, the guidelines say. Bicycle injuries, we know we need bike helmets, and if they're falling a lot, wrist guards, whatever they need. Skates, skateboards, scooters, all sorts of accidents. I have a story about an ATV. I'll tell you when I get to that one. There are people who live in areas where they have those, and they are very dangerous for children. Trampolines are the highest rate of injury for children. They're up, falling off or falling between the cracks, breaking legs. So they really do not recommend these at all. So having proper equipment is important. So this child has gone from totally dependent on mom and dad to now starting to get more independent. It is scary for the parent. The parent feels like they're not my little baby anymore. But we need to get them ready for when they graduate high school, go away to college, or go out on their own. So we need to have them have that independence slowly, but it is very, very difficult because now we've gone through parents are with their children all the time. So now the child wants to go to Danny's house for the weekend because, having dinner at their house or a sleepover, and they don't want you anymore. So it is okay for that. It's part of that growing up. Now, there are some behavioral conditions that occur in school age. Attention deficit hyperactivity disorder. Now, usually we see these children, we're going to see them early in the school, kindergarten, first grade. This is the child who can't sit down, who's always getting up, disturbing the class, cannot finish any assignment at all, and they're always interrupting in the school day. Usually these children, the teacher, because they need to teach the rest of the class, will send these children to the school nurse. And usually the school nurse figures out, what's happening and makes a appointment with the family to come in and listen. Now, don't ever assume if you ever a school nurse that these families have done nothing to help their child, because many of them have done so many things first. So the first thing you need to do is to listen to everything the family says on what they have done for the child, and then make a plan to care for that child some more, okay? Because don't assume they've done nothing. Some of them have done so much, and you'll be shocked on how much they've already tried. So the child has that avulsed tooth. The parents are reluctant to try to implant the tooth. Of course, I wouldn't, even me. Where should the tooth be placed for transport to the dentist?
Cold milk.
Cold water. Cold milk,
Cold
sorry.
milk.
Warm salt water.
Nope, cold milk. Cold milk. It's the one way. Warm salt water, you know what that would do, Suzette? It would pull the fluid, like osmotic pressure, hypertonic, hypotonic. It would pull the secretions out of the tooth and kill the root. Cold milk is the best. Yes, I'm glad you said that, because that's what many people would think. Okay, adolescents. I call this on the roller coaster with children. You know, this is that transition between being a kid, a child, and growing up into adulthood. This is the ages of 13 through 21. It is an 8-year period, or 18, you know, up to 20, whatever 18, whatever age you want to put the end of it to. There, you don't have to know the exact end. They grow rapidly physically again. That pre-adolescent growth spurt, 20 to 25% of their height is going to grow during that time. I know trying to feed my son at that time was difficult. He went from 5'7" to 6'2", you know, in 2 years. It was crazy. They're growing now. Cognitively, they're becoming more aware, more mature, more social. They are starting now with all those secondary sexual characteristics. So we have those primary sex characteristics, which is what you need to have a baby. The secondary are the ones that we see, that we can look at. We can hear voice changes, boys and girls, hair growth, breast enlargements, fat deposits, moving. Boys, the first pubescent change, as I said, was testicular enlargement. It gets thinned, it gets reddened, and it gets looser. And it's somewhere between 10 to 14. Girls, as I said, you start seeing those little breast buds. So Tanner, very important thing, is a stage of what do you see and what stage? There's boys and there's girls here. So this is something that you will see again. So it starts with just a little papola coming up, just a little bit of hair. Then you start seeing that bud, that stage 2, and you can see it gets bigger and bigger and bigger as we keep going along. Their physical growth, you know, we know that because of, you know, their sexual maturation, we're going to have all of these growths going on. As I said, that pre-adolescent growth spurt, 20 to 25% of their total height is achieved during puberty, and that's between 2 and 3 years of time. We know that obesity is associated with girls who get early menarche, you know, their menses early. It has nothing to do with boys. And as I said, voice changes with both. So Erickson, here we go, adolescence. Think about sense of identity. Think about you being an adolescent. Who am I? Who do I like? Do I like boys? Do I like girls? Do I like both? Do I like none? What do I want to be when I grow up? What groups do I want to hang with? What sports do I want to play? Am I at arts? Am I music? Am I this? Am I that? I don't know. I have no clue. And that's that identity. Who am I? Makes sense, right? Social development. Now we're trying to get away from mom and dad and them telling me what to do. They feel that they're old enough, they can make their choices, and mom and dad doesn't need to tell them what to do. So there is a lot of ambivalence with it because they still love mom and dad, but they want to be out and they want to be with their peers. But when you see this intense sociability, intense loneliness, think of this. This is things that can happen. So they're out, they've got their best friend and they have this guy they like. And all of a sudden you see your best friend out, you know, kissing this guy you like. Now you've lost the best friend and the guy you like. That's the intense loneliness, because now your best friend is not your best friend anymore. She went and kissed your guy that you wanted to be with. So that, again, that intense loneliness and sadness that comes with it. Again, they want to be accepted by peers, so they try to do and be what they want them to do. Relationships with their parents, again, parents were that protector. They're not anymore. Now they are trying to earn these privileges and responsibilities. And they, you know, think that going to the movies every Saturday night with their friends is, they should just do it. That means that they don't need to do anything to earn it, whether it's getting their homework done, making their bed, putting their clothes away, doing their laundry, doing a chore in the house, whatever, taking the garbage out every night, whatever it is. They're not doing what they're supposed to do, then the privilege is not going to be there. And these children have an issue with it. So between ages 15 to 17, there is this major control over being that independent person and their responsibilities. So there is conflict. How do we take this child who wants to do what they want to do when they want to do it without, showing that they've earned it, is for that parent to sit down with that child, and make down, some sort of contract of what you need to do to get things done and set those limits. Yes, you can go to the movies on Friday night, but you have to be home, at 11 o'clock. Whatever the time is, sitting down with them, very difficult time for these children. The relationship again with their parents, again, it's all that turmoil. I basically expressed that. Now, relationships with peers. Now, peers are extremely important to adolescents. It gives them that sense of belonging and feeling, and it starts them to be more autonomous within their own group. Again, personal friends are usually same sex. The one thing about best friends, and when you're in adolescence, how you treat your best friend as an adolescent is usually how you're going to treat your partner for life. So if you see a best friend, that's a high school age taking care of their best friend, we know that that's probably going to have a healthier, relationship for that long-term relationship. So how do we as new nurses go in and speak to these adolescents? Remember, we're adults too, so we're the bad guys. So the first thing you would do is to do something to open them up. I would like to say, you have an adolescent walk in, and let's say you like the way their hair is, or you like their sneakers, or, you ask them, what are they interested in school? Do they like music? Are they going to go to college? Start to make some reference. They're listening to music. What music do you like to listen to? Get that break. That's what you do with adolescents, okay? Another thing that can occur especially when you see them in adolescence, girls and boys tend to start dressing the part of what they want to be in the peer group they want to be. And sometimes you might see a female dressed up with shorter hair, looking more masculine. So you're wondering, what do you call this woman, this adolescent? Do you know what you do? You ask them. So what do you want me to call you? Just like if you don't know anything about culture, ask. I don't understand. Can you tell me how I can treat you the best? And you will find that adolescent that you've asked that to will be more appreciative, that you've asked and you've noticed that they wanted to be called something different. Let me see on their chart, they're called Rachel, but they want to be called Ray. Okay, that's cool. So now you know how to dress the girl and give her respect in the manner that she wants, okay? So adolescents are difficult to talk to, but again, start asking me about their social life. What do you do to fun? Are you dating? Where you want to go to school? How you doing in school? What sports, etc. Because adolescents, they only have you to talk to about sexual issues too. And you do not need a parent in the room to talk about it. In fact, what you see with parents in the rooms, adolescents won't answer. I know if I was in the room with my mom and dad, you asked me something about sexual stuff, nope, I don't know what you're talking about. If they left the room and I had questions, now I've built up that rapport. I'm telling you, they're going to talk to you about things. I know I would be more comfortable too. Now, parents might ask you, I really have a hard time talking to my child about sex. Again, where do you go to? They go to the school nurse. School nurses are great. So around ages 12-ish, we're going to be doing that HPV vaccine, and that does prevent precancers and cancers for children. Boys can get them too, not a problem. Nutrition is important. When you talk about adolescents, they're going through this rapid change and this growth that's going on, and they're all about body image and looking good. So you will see them pick up a protein bar and a bottle of water and head out, maybe an apple if you're lucky, And that's what they're going to eat all day long till they get home for dinner, because they don't want to be fat because of body image. They don't want that. So asking an adolescent about what nutrition they're eating is very important, because they're really not eating the way that they should. Plus they're busy, just like all of you are busy. You know, pick up something quick and go, because that's your life right now. If we have any questions regarding their eating habits, have them do that 24-hour diary, and that can give you some idea about how they're eating. Now, adolescents should rest a lot, because didn't I just say they're gaining 20 to 25% of their height in 2 to 3 years? They're probably exhausted. They don't get it, but they should get it. Why don't they get it? Because schoolwork needs to be done. They need to go out with their friends. They got things to do, places to go, people to meet. So they're not getting the rest the way that they should. They're not getting all that exercise they should usually. And we need to be concerned that they do take care of the teeth, and they do brush, and they do floss. Again, sexuality, education, we know today it's all over the media. We know it's more than ever. I see differences in the last even 20 years with it. Again, school nurse is great. And then if we still have Planned Parenthood around, it's also good. Safety promotion, as I said, motor vehicle #1, whether they're in it or driving the car now. A lot of accidents can occur, and this can cause problems. Then you would go into firearms, and then you would go into other issues are suicide. And why suicide? Body image. They don't feel good enough. They feel less than. They have no one to talk to. Okay, especially if the parents aren't involved as the way they should. Again, whenever they're in sports doing things, always give them good protection, whether it's the shoes, whether it's the shins, whether it's the helmet. So Matt is 14, he's eating all the time, but his weight is appropriate for his height. What's the best explanation for that? Remember what happens at that age. They're growing 20 to 25%, a foot or two. It's normal, because they're getting bigger and they need the nutrition. They're building what their body is becoming. So that's school age and that's adolescence. Any questions? All right, who wants to win a Kahoot today? Oh, Andres, okay, who else? Oh, Raul. Lamar, yeah, maybe. Last one, Ed always likes to win. I know you. Jose, you too? All right, we could do that. All right, it's being a pain in my butt. Let me go back and get it for you. One second. I'm on teaching. You silly or what? Gotta love your kids. I am my grandson's favorite play toy. Hold on, almost there. I had to re-sign in. Here we go. Eight, 9, 8, 3, 0, 6, 8. All right, let's get going. Week 3, school age and adolescent children. How does the onset of pubertal growth spurt compare in girls and boys? Remember what I told you what girls think in about 5th or 6th grade as compared to boys? So in girls, it's 2 years before boys. Yes, very good. We had some people quick on the button. Good. At what age should a parent expect to have major conflicts over independence and control with their child? This is when they should sit down with this child and make some sort of contract of what they need to do to get their privileges. And that's ages 15 to 17. So they're, already grown, they're already bigger, they've already gone through puberty, their voices change. Men got the hair on their chin, they think they're doing good, but they still need to do their, what they need to do before they can get their privilege. The onset of puberty in boys is characterized by so boys, you will see testicular enlargement first. That's the one that you will see. I mean, when you see voice changes, that's the beginning of puberty, you see it, but it's the testicular enlargement, which is the one. Signs of the onset of puberty in girls. I think that's the easier one. And that is that development of breast buds. Absolutely. Majority's on fire. What do we use to determine if a female has reached the age of menarche? So it's Tanner staging, and you see it's 1, 2, 3, 4, 5, and knowing which comes first, second is also important for that. So please review that so you know it. The source of injury, whether intentional or unintentional in adolescence, is associated with and that's motor vehicle accidents. As I said, this is throughout from infants all the way into the adolescents. Very good. If a parent feels uncomfortable talking about sex education, who's a good resource? An adolescent can go about and talk to friends and stuff, but to get the best information, it is the school nurse, or if they're in a hospital with you and you're taking care of them, you as a nurse. And what we do is we give them information orally and written form without putting your opinions in there. Only what the information shows you, okay? So it's only information, not saying, well, you shouldn't be doing that, because you know adolescents are going to do what they want to do. At least give them the information they need. And 9-year-old friends tell him soccer is a dumb game. He should play baseball. What's that all about? We know that peers are extremely important and they love to please them and they want to keep with their peers. So they're going to switch from soccer and they will play baseball because of this peer. Very important. During admission, the father of a 16-year-old says, "We are Buddhist. Culturally competent care includes what?" Well, how are you going to find out? How are you going to make sure that you're doing? What does culturally competent mean for a Buddhist? So always, you don't understand who a person is, what they need, a different culture you've never met. These people will be very happy if you ask, what do you need? What are your preferences? There are cultures that they don't want their female daughter taken care of by a male nurse, or it could be the things with food also. When teaching sex education and contraceptive for adolescents, what should the nurse consider? And what they need is only information. You're going to give them education orally and the written form, and that's what is, said to be the best. And, we can't predict when and how they're going to do it, if they do, but all we could do is give them that information so they can at least have that. A multi-select. The management of adolescent obesity should include what? So we're going to keep that 24-hour diary, find out what they're eating because we don't know. Always, any diet, I don't care what age, you need to incorporate sometimes some of their favorite foods. So at least they can have like that little cheat day, but we'll have this much, not this much, okay? Diversional activities, we're not going to do that while they're eating. Diversion is good, but for younger children, not for adolescents. And they don't want nutritious foods for a reward. They want some of their favorite food. So that's why those are the answers. Infants go through a predictable sequence of growth and development. This is called. You'll see, I'm going to throw questions in from week 1, 2, 3 as I keep going. And it's called sequential trends because it happens in a sequence. This is what's coming next. It's a sequence of events. And you see it says sequence of growth and development, okay? Which benchmark serves as the ending period for school-aged children? It's right before they start into adolescence. Starts with losing their baby teeth. It ends with the onset of puberty. Okay. Beginning school is the beginning of school age. That's when they start in the kindergarten. Wisdom teeth has nothing to do with, some children don't get wisdom teeth till 20, but it is the onset of puberty. An example of indirect bullying would be if what? Today with computers and children of all ages, my little 5-year-old grandson's always with my phone, playing games or watching YouTube videos or listening to music. I don't know how he gets to those places, but he does. So this is going to be a real thing that I'm going to have to be watching out for, because they can hurt children. There's been movies on children bullied over the internet who's actually committed suicide. And it can happen because, we can make children feel really bad about themselves. Which action would improve dental health in the school age child? Remember, if they're able to. Remember, first graders are not old enough yet. They just can't. That manual dexterity. So every school age child, when they get the ability, should brush their teeth and floss their teeth. But all children should brush their teeth. Generally, the earliest age at which puberty begins is? Ten in girls and 12 in boys at 2 years difference. Good. An 8-year-old girl says she has cancer because God is punishing her for being bad. Why does she say that? Where's that come from? Remember, school-age children are very curious about religion and learning and wanting to know about God. And it's an absolute common thing for children. I'll see many a child come in that have an appendix that needs to be taken out. And I know before surgery, I'll sit with them and I'll say, listen, you did nothing wrong. You're not being punished for being bad. This is just something that didn't want to be there anymore. So it says, I want to go. And you could see these children feel so much better knowing they did nothing wrong that made God do this. A 5-year-old needs to get a chest x-ray. What explanation's the best? 5 years, 6 years old, 7, depending on mental maturity. And they're going to use a little big camera, you're going to take a picture. You tell them it doesn't hurt, they don't understand what that means. And tell them you take an x-ray, they don't know what that means unless they've had them before. So just doing the global, you could take a camera, it's a big camera, and take a picture and we can see your insides. And when it comes back, I'm going to show it to you. And they just think that's really cool. My grandson says. How do you get an adolescent to open up about their sexual history? This is the 3rd time that this girl's coming in with a urinary tract infection. How are you going to get them to open up? Because it's probably what's going on there. So tell me about your social life. You're going to open it up with something, just like not approaching that toddler right away. You're going to talk to them first, then you're going to, talk with them. Same thing. Open up that comfort level with talking about what music they like, if they play basketball, if they've seen the latest movie, etc. That all helps. And then they feel more comfortable to tell you about those things. How do you get an adolescent to be more receptive about talking about their health and sexual exploration? You know, this girl who's been in there 3 times, urinary tract infection. How am I going to make her talk? Well, of course, tell me about the social life first. I've opened that up. Now what do I do? I'm going to have the parents get out of the room, and I can do that. Now, do I have to tell the parents what they said? No. It's a private conversation, unless it's something that will harm themselves or others. Okay, that's the only time I have to say it. But letting them talk and you giving them information is the best thing for these children. Then they can have the parents try to ask the child, so what did you tell her? A multi-select. When educating adolescents about risks for HIV and hepatitis, what would you include? These are very real concerns. I mean, for all ages, but these children, do they know about this stuff really? Or only what they've heard or with their peers? I mean, we know abstinence is the first thing for sure. Not everyone will do that, but condoms, if they're going to, and hand washing never hurts. Weekly showers, well, I hope these children are showering more than once a week. I hope so. A child has a knocked out tooth. Where should that tooth be placed for transport to the dentist? You all know this one. It's the warm salt water, right? I gotcha. And again, it's cold milk. Very good. A nurse planning care for a school-age child should know which thought process is seen. School age. What did I tell you about school-age children? This is that ability to conserve. Remember the little Debbie cakes that they'll have enough to go for the whole week long? And it's just like having uniforms. It's how many you have for the week. If you get them all dirty or don't hang them up, you don't have any more, well, you're gonna have to wash more. And you know, a kid doesn't want to do that. So ability to conserve. Magical thinking is younger. That's more like your preschooler who's playing with toys and talking and flying cars and dolls in the air and stuff. That's magical. What stage of Erickson's would you use for school-age child? Industry versus inferiority. And what does that mean? Industry is a task they can master. Inferiority are those things they can't do because they just can't do them. And they feel inferior for that. That is one of the most important ones of Erickson that you need to know. And also the infants, mistrust, trust versus mistrust. Those are two of the ones I've seen on every, HESI that has came up. So please remember those. I'll multi-select. Anorexia nervosa is characterized by. Now, I didn't go into a lot of this, in lecture. I didn't cover it, so I'm covering it here. We know what are adolescents into. They're into their body image, so they don't eat well, right? So anorexia nervosa is all about fearing to gain weight. They are unrealistic with the amount of weight to lose. They think they're still fat in their bones. It is severe calorie restriction. It has nothing to do with vomiting and purging. That's bulimia. How would you know the difference of a very skinny child? Is it anorexia nervosa, or is it bulimia? Well, think about vomiting, and what comes up with vomit is gastric juices, right? It's going to rot the teeth, especially if it's going on for a while. Anorexia nervosa, your teeth are going to be good because you're not vomiting. You're just not eating, okay? Those are the things that you would see at an assessment just by a look. We know that it's anorexia nervosa. It's not the bulimia.
Would dental decay be like a possible long-term effect of anorexia due to like the malnutrition?
Not necessarily, no. How do you know you suffer from bulimia? You know, children or malnutrition who don't eat well are not going to get dental decay because there's no sugar, there's nothing in there for it to create dental decay. The bulimic, who is that eating like all of this crazy amounts of food, and then they vomit and vomit and vomit and vomit. It's that gastric juices, that acid, and of course, all of those sweets that they're eating too that are killing their teeth. But that was a great question. Made me think a little bit. The leading cause of death from unintentional injuries in children is? This is the last time I'll ask you. I think you've gotten the point. Motor vehicle fatalities. Very good. You all got that one good now. Adolescents are. What are they? Difficult to handle, stubborn, obstinate, want to do what they want to do, don't want to listen, want all the privileges with no responsibilities. They're stuck between being a kid, being an adult. But remember, they're confused. They're troubled and frustrated because it's that identity. It's a feeling of, who am I? Where am I going? What I want to be? You know, this is a time where they have to make those choices. What is an adolescent heart rate? So adolescence is slightly lower than the adult. Remember, 60 to 100, you would see with adult. Slightly lower because they're more active. They're moving more. Their bodies are more physically capable. So 55 to 90 is your adult. 60 to 120, 120 is too high. You have a fever at 120, or you're dehydrated at 120 if you are an adolescent, okay? And 40 to 85, that's way too low. When talking with an adolescent regarding personal health concerns, which is most important? So absolutely, you know, you've got to give this child, this adolescent, the opportunity to be able to express themselves. So then you know where their minds are sitting, you know what they're understanding and not, and then you're able to help them better, you know, by understanding them a lot better. Give them that time to share. A parent says their infant puts everything in their mouth. Based on Freud's theory, you would respond. Why do they put things in their mouth? Because they explore everything through their mouth, and they soothe themselves also. They comfort themselves with things in their mouth. So Freud is all this oral, and this oral stage has to do with exploring, you know, through their mouth. Very good, guys. In addition to injuries, a leading cause of death in adolescents ages 15 to 19 are, well, we know that there's the motor vehicle, yes. Now, what are the other two? Homicide and suicide. Homicide because they're into fire guns, firearms, they're looking at them, they go off, it could be accidental or not. And suicide because they get into very severe depressions due to body image issues or that intense loneliness that happens from those other peers, hurting them, whether, your own personal fear or somebody else's that, are posting social media, any of them. So suicide is real, very real in adolescence, and so is the homicide. In school age conflict of industry versus inferiority, what does industry mean? The industry is the task that they can master. They can play sports. They're good at spelling. They're good at math. They're good at handwriting, whatever. They're good. They feel great. They're being praised for it. Inferiority is what they can't do. At what age does intuitive thought start? They're starting to see that things are green and this is something else. It's a color green. It's the same color, but it's something different. Intuitive. They're starting to figure things out. Yes, it's at that early stage of school age. Which age group prefers to be with members of their own sex? This is the same sex peers. And that's the school age children, about 7 to 11, that age. That's when they want their same sex peers. When you talk about older children, they want to be with members of their own type of group, whether the band or the sports or whatever, the music people, that's different. But same sex peers are the school age children. Which age group will have a tendency towards eating disorders? And that is the adolescents for sure. Again, it's all about body image and not being what they want them to be. They want to be skinnier and prettier. True or false? Home support is invaluable to the adolescents. Do they need mom and dad? Are they invaluable? Are they going to be there to pick up the pieces when somebody hurts the child? Yes, they are extremely valuable. Now, they're not wanted most of the time, but they still need to be present and available for the child when they need it. When they're hurt by their friend or, something happens in school, they need mom and dad to, help support them, because that's who always have given that hug when they're in trouble or need help. Contraindication to administering the varicella vaccine to an adolescent. Varicella vaccine is a live vaccine. What do you know about it? So live vaccines are not given to immunosuppressed people, and it's not given to someone on steroids. This is a question you're going to see in MedSearch. This is a question you're going to see, I guarantee you, on your NCLEX. It's one of those questions like, what are they talking about? And they could put any age child or adult in there, doesn't matter. Remember, live vaccines you cannot give if a patient is on steroids at the moment or immunosuppressed. To improve adolescent health, adults must increase health enhancing behaviors like what? They need to eat good, they need to exercise, they need good sleep, and usually they don't get all three of them. So, if they improved them, it would be better for them. What clinical findings does not indicate an adolescent may be suffering from anorexia nervosa? Remember, anorexia nervosa, you've got good teeth. You have decay in teeth with bulimia. Very good, you listened. The risk of depression in transgender children is what? We have, this new craze and on these HGTVs, and they're talking about jazz and all different types of differences that we never talked about before. Now, transgender children do have a lot of issues. And as nurses, if we see that child, we need to be aware of that because maybe they need you to talk to. So opening up that channel of communication, allowing them to talk may save a child's life, a transgender child's life. A 14-year-old is in the emergency department after a biking accident. How should the nurse interact with this adolescent? So if a 14-year-old's coming in for a biking accident, it's probably like a trauma type thing. Nurses, what do we need to do? Well, a lot of people are going to come at them all at the same time. What's good about adolescents, most of them understand if you talk to them. So let them know what's going on and answer their questions as they're asking to keep them calm and quiet. What if they have a big gash wound that's bleeding and they're upset? So they're getting tacky, they're, anxious. What's happening? They're bleeding out a lot quicker. Calm them down. Tell them what's going on, what you're going to do, and answer the questions. So what have you done? You've calmed that child down, which is what you need to do. I was a primary trauma nurse at the children's hospital where I just came from. So it's happened before, and that's exactly what I had to do for that child. Cooperative play. As you see, I will throw questions in there for you to remember. Trying to go over it one more time. Cooperative play, what is it? And cooperative play is like a board game. It's like playing checkers. They work together, they create something, or they play a game, and there's a goal. Somebody wins. Or this is what, when we're finished, this is what's going to happen. Cooperative play. It is organized. What does moral development involve? Morals. And it's all about right and wrong. Remember, moral development is all about Kohlberg, and this develops as we go on through our lives, being, always known that we should do right, we shouldn't do wrong. But again, as we get older, we start manipulating, well, if I do this, it's wrong, but if I have to do that but if this happens, well, you start taking that and start learning more about why you're doing right or wrong. I mean, you're going to do either or anyway, but moral development is all about right and wrong. And again, that comes from Kohlberg. Developmental milestones are important to observe because of what? Why do I need to know if this child is sitting up, rolling over, lifting his head, buttoning his shoe, hopping, jumping, walking upstairs, dressing? All of these things are developmental milestones. It's because we can get these children to early intervention. Children placed in early intervention come back and catch up and sometimes go farther ahead than children who never needed it. So early intervention is all about starting it when you recognize it. Lymph nodes in children with normal findings, what are they? They should not be able to feel them at all. Lymph nodes should be felt when a child is sick. That's it. The right second intercostal space landmark of the heart is called. There are in your book, a picture that looks similar to this, and it shows you where to listen to these things. These are important to remember. You're going to need it for capstone too. That's why we're reviewing this right now with you. And that's the aortic valve. So know your valves. Not only you're going to see it on exams, with peds, you're going to see it when you get to your capstone, when you do your checkoff there. They've had to go through and tell which valve was where as they were doing assessment. So very important thing, bringing you back to health assessment. Which nerve controls critical movements of the tongue? What nerve do we test when we stick our tongue out? I told you. That's the glossopharyngeal, okay? Knowing that is another one, cranial nerve 9. What type of breath sounds do you expect to hear over the trachea? It's the trachea. It's not over the lungs. And they call it bronchial breath sounds that you hear in the trachea. You could hear it's like upper airway, bunches of mucus that you can hear in there. It's called bronchial breath sounds. Depriving a child of food, clothing, and shelter is called what? This is the absolute definition of neglect. There was one case where a child was up front of the house playing by the street. The ball went into the street. The child got hit by a car. It was 30 degrees outside. When they came to look at the child, the police arrested the parents because the children had no jackets on and it was 30 degrees outside. That is neglect. I mean, that's the extreme, but it can happen, okay? Which of the following immunizations is given at the adolescent stage? And that's your HPV. Varicella, influenza, we give it all the time. But HPV is the first one we give as an adolescent. ADHD most likely involves which of the following? How would you know a child is ADHD? And that's inattention, impulsivity, and hyperactivity, the inability to finish any task started. And these are those children that can disrupt the classrooms. Again, these children will be sent to the school nurse, and that school nurse will set up a meeting with the parents. Again, let the parents describe what they've done to try to help that child before you try to make a plan for that child. Last question. Adolescents typically place blank on peer relationships. Do they like peers? And it's absolutely, this is all they base on, is their peers. Their peer relationships are the most important. There we go. See how we did today. Good job. Megan, number 3, good job. Number 2, Con, number 1, almost the whole way through. Liz, good job, Liz. Number 4, Marjorie and Suzette, good for you. You knew that warm salt water was good. All right, what I want you to do is sign your attendance attestation. Do I have any questions from anybody about anything? Remember, this is the week of reviews. 1 live review attend minimum, okay? All of us are giving something Tuesday, Wednesday, Thursday, Friday, Saturday, and there's doubles on several days, morning and evening. Please make sure that you listen to the reviews. If you have issues with dosage calc, go look at my dosage calc video. It's good. Students told me they like it, or make an appointment with me and I'll help you. Also ask me for the 3 worksheets that go along with that dosage calc, okay? Anything else I can help you with? We're done for today. Sign your attestations. You've been doing really good. Good job.
Thank you, President.
You can say
Bye.
hi now. Say bye.
Thank you.
Come back for me to
you.
review those quizzes. Give me 5 minutes, okay?
Professor Bogart,